What's up, guys? Dr. Sean here with a video today. We're talking about the best ways to recover from tendon pain. Now, your tendon pain may be due to a tendonitis or some sort of tendinopathy that you've been diagnosed with, maybe from a healthcare provider, maybe you had imaging done, such as an MRI or an ultrasound. The reality is, the pain that you're in and the recovery that you're looking for, we want to touch on some 5 points here, 5 key points. Try to keep it real simple, and in the process help shed some light on some myths or misconceptions that have persisted in regards to healing or recovering from tendon pain. So the first point we want to make here right now is you have to move. Oftentimes someone is advised to completely rest, and the problem with that is complete rest becomes ineffective because it reduces our tendon's ability to handle load. And that's the primary function of the tendon structures in our body, is they help to handle, absorb, and dissipate forces in our body. Complete rest reduces that ability. The other problem with complete rest is movement drives our healing mechanisms in our body. It drives blood flow, it drives signaling within the body to help the healing process. So someone that basically is completely resting or avoids activity is going to delay and compromise their healing process. So what's better advice becomes, you want to modify your activity levels. You want to modify them to your tolerance, avoid things that are causing pain. But those things that you can do pain-free and that you don't have much limitation with, you want to continue to do those, and we can find a window of activity that you can be successful with. We can build upon that, and then from a rehabilitation standpoint, you want to gradually strengthen and progress someone through that. And that brings me to point number 2. From a rehabilitation standpoint, this is why active rehab is going to be a priority over passive treatments. And the reality is, a lot of times, yes, we need to do passive treatments on the onset to help with pain control and things of that nature. But long-term interventions and treatments such as electric stim, ultrasound, laser, cupping, taping, needling can become largely ineffective in producing the long-term outcomes and efficacy that we're looking for. So we want to incorporate active rehabilitation methods. Active rehabilitation, in essence, what we're talking about here is exercise-based therapy. So you're going to have to move. And the problem with that is most people will divert away from it because movement, exercise is harder. It's a lot easier to want to come in and have something done to you. It feels good to lay there and get worked on, or get an electric stim treatment, or get some sort of heat or ice application. But long term, you're not training the tendon to regain its function, just like we talked about previously. So you want to take steps within a rehab program to gradually strengthen yourself. And obviously, this is going to be harder to do. It's nicer if we can just kind of kick back and relax. But keep in mind that the hard stuff is always going to be more effective than the easy stuff. You see it in training, you see it in nutrition. And so if we are always focusing on the easy stuff, you're never going to fully realize a complete successful outcome. Third point here is to stop ignoring your pain. For many people that I work with, and this is a fault that I think many of us are guilty of, but realize that pain is your body's way of telling you that something is wrong, and that if you continue to ignore that, you're only continuing to irritate and exacerbate your tendon pain. So understanding that pain is a sign that something's off, something's abnormal, and that you need to do something about that, i.e., okay, again, we got to understand that tendons' primary function is to absorb load. So a lot of times when pain is present within the tendon, it's because it's being overloaded. So you need to change something, whether as you reduce your training load, your training volume, training frequency, or how often you're doing stuff, because how do you expect a load-related issue to be solved if you never address changing anything. If you're continually exposing that tendon to the same stresses over and over again, it's not going to magically heal. So stop ignoring the pain and do something about it. Fourth point here is oftentimes some people might take on an approach, or they might be told to stretch their tendons. The reality is you don't need to stretch, and you shouldn't be stretching your tendons. That can only further irritate and compromise the health of the tendon itself. Our tendons don't need to be flexible. Our tendons actually act more like a spring, and they need to be able to absorb and release force. Okay, so if you stretch a spring, you're actually going to compromise its function, and the same is true of the tendon. What you need to do is realize that the tendon needs to be strengthened, and it needs to be retrained to have that proper function, like a spring mechanism, and it's not going to be accomplished through stretching the tendon. So stop stretching the tendon, and you'll be better off for that. And then fifth and finally here is the realization that there are no shortcuts in rehabbing from tendon pain or tendinopathies or tendinitises. Oftentimes these can take months to recover from if they're severe enough. And the reason is, tendons take time to rebuild strength. They take time to rebuild their proper function. And if we're constantly trying to look for that magic pill or potion or some sort of modality that are promising some sort of cure-all, you're not really going to find yourself anywhere ahead of the game, because while they might provide some sort of short-term pain relief, they're not going to do much in terms of preventing that pain from coming back. So the acceptance of the realization that there are no shortcuts, that you're going to have to put in the work, you're going to have to focus on exercise-based rehabilitation, and realize that if you're going to come around to a full and complete recovery, you have to take on the work. You have to be diligent about it. It's often going to be day in and day out from that standpoint. So hope this was a helpful video for you. As always, leave any comments, questions. Happy to be a resource for you guys, and thanks for listening.